All right, hello everybody, and welcome back to the Pure Roundtable. And today we got Dr. Vidal in the hot seat. And today we are going to talk about some non-surgical options. So, as the summer comes by, some patients maybe they were too late, or maybe they're just not ready for surgery, but they still want to look their best this summer. So, what are some of the things that we can recommend to make sure that they glow and feel their best during this time?
Love it. Great. It is very good, very important to talk about the different options that we have and not only surgery. A lot of patients think that we only do surgeries, and that's not true. We have other non-surgical options. And when we talk about aesthetics or aging or changes, we have to divide it in different layers. And I think the layer that we miss the most is the most important, which is the skin. We have to treat our skin, and the skin texture, it has to do a lot with aging. So you see, for example, J-Lo, she looks beautiful, she looks glowing. Has to do a lot with the skin quality and how she keeps her skin quality looking young. Those fine lines, those pores and all this. So skin care, it is very, very important. So I would recommend everybody getting into some medical grade skincare, because it is not just about just buying a moisturizer over the counter, but important in knowing what's in that moisturizer. SPF is extremely important, because one of the key components of aging is actually sun exposure. So the skin reacts a lot to the damage from UV light, so protecting it from that. And of course, we have like other treatments in the body, like we're talking about neurotoxins, injectables. But the other one in the body that I think it's great, that if you're like a little time constrained, it's going to change a lot your lower body, is treating the cellulite dimples. And that is a quick appointment, in and out the office, very low downtime. It's done under local anesthesia. So a very good option if you're wanting to look better in a bathing suit without going through like a BBL or more surgery, and you're closer to your vacation date, consider it happily.
Yeah, and I think another good option, if you just want to deal with the hip dips, is also the aloclay. So you guys have heard us talk about this. This is off-the-shelf fat, and we can use that to fill out the hip dips. And again, it's a procedure that's done under local in the clinic setting. You're in, you're out, you're recovering. Within 2 weeks, you're back on the beach.
Yeah, and treating that lower body completely talked about heavily. We talked about aloclay. Morpheus is a great option, which is microneedling with radiofrequency to tighten the skin. And on the skincare route, we have some options for body that also include retinoids to improve the skin quality and have a complement better lower body shape and form.
And if you can't tone it, tan it.
From the South Florida guy.
No, but seriously, don't do that. You want really good SPF protection, because that's going to maintain your skin for the long term, and sun damage is the number one cause of aging of our skin. So make sure you're using a good SPF this summer.
Definitely, and hydrate and eat well, all of it.